Yeah, so I have quite an unconventional route because my first degree was music, um, which is not what you necessarily think of when you think of somebody going to do med, and I did that at Oxford. Um, but I found when I was doing my degree that I really liked working with people. I liked volunteering. I missed sciences. And so I decided I wanted to do medicine. So after graduation, I spent a year working as a healthcare assistant at the John Radcliffe Hospital in Oxford, and then got into medicine. So now I'm currently in my first year of graduate entry medicine at Warwick.
So I guess it begs the question of like why medicine in general. Obviously, you started your career is going into music. So what was the main driving factor for you to move over to come back to sciences and study medicine?
Yeah, I think like a lot of people, I liked a lot of subjects and found it quite hard to decide what to study at university because I had different interests, like many people. Um, but what I found with music, and sadly with quite a lot of humanities subjects, um, careers are difficult to get into in those fields. And so I did consider becoming an opera singer. Um, but pursuing that, I knew I could potentially have a really interesting, challenging career, but I could also potentially not have that at all and have something which feels really boring. And I knew something that I valued overall was two things. One is that I wanted something that was going to be challenging and interesting every day, and something that I felt was of value and gave back to people. And everywhere I looked, it kind of medicine was
Yeah.
the thing which I think combines that. And I think that's why most people like medicine. It gives that really multifaceted thing of challenge and interest and giving something back.
Yeah, I guess speaking to you and speaking to numerous other people before you, even just at Warwick in general, the people that I've spoken to all have a common interest of medicine, but it's their backgrounds that set people apart. Of you're not just a doctor anymore, as you say, you're a musician. There's countless other people that have come from like if that be like research based degrees or humanity degrees. So I do totally agree with that. Um, I guess moving on to like your admission side of the application, which admission test did you sit? Was it just a UCAT or did you sit any like the GAMSAT or the BMAT?
So I did only sit the UCAT. I considered the GAMSAT and I prepared for it, but I just couldn't bring myself to actually do it because I'm sure you've looked into it and you know it's
Yeah,
quite a big test. And whilst there's great universities that require it, they were universities that I didn't quite click with as much. So
yeah,
I did UCAT.
yeah, for sure. And I guess how did you personally find you how did you find the UCAT? Like, is there any particular resources that you use that you found were useful whilst revising for it?
Honestly, I think online and things like Instagram and the like, where there are sort of med communities, one of the best things I found was resources that other people had made and advice that other people had to give. Um, I've subsequently done similar for other people, given advice based on my experiences. Um, and I found that really useful. Other than that, Medify, like lots of
Yeah.
people suggest, Medify is really good. I only did a month subscription for that, but I found that was enough to just do loads of questions. Um, and Past Medicine also has quite a lot of free questions. And I think the thing is just practicing the questions, to be honest.
Yeah, totally agree. And I guess talking about your work experience side of your application, obviously you got into Warwick, so you must have had extensive work experience. What types did you undergo? Obviously, you mentioned your healthcare assistant role, but did you undertake any other types of work experience?
Yeah, I did. I did the healthcare assistant job for a year. which I had no experience when I started doing it, but it was really interesting. Um, I I also did quite a bit of shadowing mainly. So I did some shadowing in vascular surgery, in a GP, a few different psych placements, and I also did a very niche performing arts orthopedics shadowing. And I actually really recommend, if people have really niche interests, try and get shadowing in those, like contact people in the most niche specialist things, because often they're really keen for people to be like interested in something that most people have never heard of.
Yeah, so it sounds like you've had an extensive list of, well, different opportunities on, if that be like surgery or just as your general occupation at the time. So it does sound like you had a grasp of what you were getting into before you actually applied for medicine. It's great. So I guess ultimately, what universities did you end up applying for?
So I only applied to Warwick and Newcastle, which very risky, but
Yeah.
it worked.
So I guess moving on to like the interview stage of those, you got an interview at Warwick. Was Warwick your only interview? Or
I also interviewed at Newcastle,
okay.
but ultimately I chose to go to Warwick because it had just more things that worked for me, closer to
Yeah.
home as well.
Yeah. So were they both MMI style interviews at the time?
Yeah, both MMI.
So how do you feel like you approach the MMI style of interviews? Because I guess this is what trips up most people of like the obscure types of questions that they can ask.
Yeah, and I think in some ways, some questions and stations can seem very random, but they're always going to be looking for specific things.
Yeah.
And I think in some ways, when people go in who are really over prepared, you can tell. I helped with the MMI interviews at Warwick just this last December from the other side. And you can really tell when something is genuine, and when somebody's worked really hard, worked through all loads of practice questions. I think on the whole, the things that I found useful were to go into every sort of station trying to present myself, trying to be open-minded, trying to give as much sort of empathy and show that I could communicate and talk as possible, because for the most part they're not looking for someone who's fully formed. And I spent so much time looking for sort of things in current medical things in the New Scientist and stuff, and honestly didn't find people ask that much. They're more looking for your skills more generally, and I think having presenting those and in sort of a genuine way, and also spending some time reflecting on your work experience. So if you'll do work experience wherever you go, really. Obviously somewhere like Warwick requires it. Spend some time thinking about things you saw which you thought were really good, things that you didn't think were as good, things that you contributed to, and how you think you contributed well or less well, and being able to reflect on that is really important. And I think something they often look for, because people often like to try and talk themselves up, which is great, but they also want people to be able to reflect on their weaknesses as well.
Yeah, I totally agree. And I guess I guess most people do struggle on the like the role playing aspect of it. Anybody can talk about themselves for God knows how long, but it's the role playing aspect and knowing what they're actually asking for. As numerous people have said, they're not actually testing you on, say, how you break bad news to this particular person. They're testing your background knowledge, like behind it, because if you know how to break bad news, you can break it to 100 different people. It's just knowing like the key concepts. Do you think that that seems true to like your type of interview that you had?
Yeah, well, I think it can be quite useful to look at sort of clinically how people might address things and do things and why. And that's something I did when I was preparing. So I thought about some of the different acronyms that you can learn of how you can sort of interact with people. And I found that was really helpful. But at the same time, they aren't necessarily looking to see that you know everything. So if you go in not knowing any of those things, or go into a scenario where you haven't really considered that, they're not necessarily looking for you to know the answer. They're more looking for if they can shape you into a doctor who can learn that and put that forward. So I think if you do go into a situation which you don't know how to deal with, that's okay as well. The best thing is just to not be judgmental to the person who's role playing, the character. Just be nice, just be open. I think that's really the main thing. You can learn things to apply, but it doesn't matter if that doesn't work in that situation either.
So it'd be more of how you adapt to a situation that's unknown, and as you said, showing like you can show as much empathy and the key qualities of a doctor as possible, so they can ultimately you're basically showing them that they can shape you into becoming a good doctor at the end of the day.
Definitely. And I think one thing I found was that most medical schools on their websites have like a list of their sort of characteristics that they look for in a doctor. And I honestly would look at those before a medical school interview and think, how can I demonstrate those things? And I think that's quite a useful thing to do if you're struggling to think of what those values necessarily are.
Yeah, I guess just to touch on that a bit more, is there any like particular resources you used for preparing for your interviews?
Yeah, so I used that book that everyone uses.
Is that the
I
I want to say the CAT plan. Is it the CAT plan, or is that for a?
I think that's something else. I don't know, but I'm sure somebody else has spoken about it
Yeah.
on here, or people recognize it. It's just a load of questions, and I looked in that, but you don't need to be too regimented or rigid. I think it's better to just reflect. And the other thing I did was look at medical school websites. They put loads of information on there. So if you want to show exactly why you're interested in a specific place, they're going to have the best things on the website.
Yeah, and I guess everywhere will have it. Everybody has a website for the interviews, so you're bound to find some generic questions that you can work through just to get yourself prepared. So I totally agree with that. So I guess having done the interview and successfully getting to Warwick, are there any like specific tips you give on people like sitting the UCAT or like undergoing the MMI style of interviews?
Yeah, I guess the best thing to do is not overthink it, to be honest. I mean, you can give so many UCAT tips and MMI tips, but I think one of the best things is I know the process is so long, it's so easy to get caught up in yourself and to end up panicking. I know people who didn't do so well on the UCAT because they panicked because they were in a time pressured situation. And I think the more preparation you can do at that, so practice doing UCAT questions in a timed situation, try and do a practice interview if you can, even if it's literally getting your dad to ask you a question and who might not have any good feedback necessarily, but you've practiced that scenario. So do anything to sort of reduce the stress in preparation and on the day, and you're more likely to be sort of realistically you, not a panicking you.
Yeah, I totally agree with that, and I guess it's a fact of knowing. No, it's a fact of it being a long process that you don't know anything above just applying to medicine until you actually get it, and you probably know yourself. It's so competitive, and people just there's such a bottleneck there of all these students applying, and as you know, I think it's like 14 medical schools only offer graduate entry. There's just the numbers per place are just astronomical. So it's actually trying to, it's that competitiveness of saying you need to be better than these 13 other people, and I think that's where people go wrong of showing their true personality. They just think themselves of you need to get a better UCAT score, a better examination ranking to get that place.
Yeah, and I think having like helped with the MMI interviews as a student, it has made that all of what they're really, what you can see in a candidate really clear. Because there have been some candidates who are clearly people who could be good medical students, but might have just seemed so nervous that how they answered a question or reacted to something wasn't as sort of organic as it might normally be, which might potentially, as you say, when it's competitive, might potentially be the difference between a place that year or not.
Yeah, I totally agree with that. I guess obviously starting out at Warwick, how do you feel you managed the transition from a non-science degree to a graduate entry? I know Warwick's one of the few that offer the non-traditional route into medicine.
Yeah, I mean, I think because Warwick has such a diverse background in people from all sorts of different degrees, there is so much good extra teaching. So particularly student to student teaching. So there's special teaching for non-science degree holders, and also just for anyone, there are student seminars held by students in older years. So there's so much peer-to-peer teaching. And actually, if I'm being entirely honest, even from the get-go, there didn't seem to be a real difference between um, science backgrounds and non-science background students. Like, everyone is keen and, you know, academic to a level to be able to do medicine. And frankly, medicine is so different from any other degree. I know people who did biomed who say, I recognize some of this stuff, but we're looking at it in a total different way, that it's not totally relevant. And conversely, because there's so much independent learning, often that works well for people from humanities backgrounds where you're used to not having that many in-person things per week anyway, so you're quite good at sort of self studying and motivating. Yeah.
Yeah, and I think Warwick, to its credit, is it's the only course in the UK that offers that full, like that full mature student degree. So you are obviously in contact with people your own age, but have come from diverse backgrounds, and I think that brings a cohort together that has a lot of different skills, and I think you can pass those skills on to different people.
Definitely.
So I guess just moving back a bit, I think I missed a question I wanted to ask you. Is there anything you wish you would have known before starting your application to graduate entry?
I guess not to get bogged down about the fact that it's competitive, because fundamentally, if your application is, you know, to a certain standard, you'll get in. And of the people who apply, there are quite a substantial number who apply without having, you know, the tick box of things you need to get. And I think before worrying about interviews, you just need to worry about the tick boxing of making sure you've got or working towards at least a 2-1 in your degree. Some unis it's slightly different. Making sure you've done your admissions test, making sure you've tick boxed anything else, and actually filling those tick boxes is the most important thing, because actually of the thousands of people who apply, there are a significant number who don't tick those boxes. So while on paper it looks very competitive, there are lots of people who apply even though they don't fulfill the criteria. So actually, don't worry if your UCAT score isn't, you know, high into the 3000s, because most people don't have that, and you just need to reach the threshold, and there will be no discrimination against anything else.
Yeah, and I guess this is a factor of the bottleneck being shown of all these. Like, I was speaking to somebody who's just had an interview at Warwick in December, and he was saying the amount of people that actually don't hit the targets and don't actually read the fine print of what the universities are asking for. It blows my mind that these people have spent almost up to 2 years applying for this degree, and they fail at the last hurdle. But yeah, I guess a good follow-up question to my previous question would be: are there any pieces of advice you'd find useful for somebody somebody just like starting out their first few days at medical school?
So like starting medical school, I would say be honest about how you're feeling about the work. Because if you say on the group chat, this is really tricky, this is not like anything I've done, you'll get a lot of people who go, oh my gosh, thank goodness. This is what I found. There have been some weeks of medical school which have been so busy and you've had so much content, or you're really struggling to remember things, or you're thinking everyone's revising old content and I'm still trying to learn current content. How are they doing that? People aren't. People are in the same situation as you. So throughout the course, try and build the camaraderie, because medical schools often have a bit of they're often seen as being very competitive atmospheres. And actually, I found at Warwick, I haven't had that experience, because people are so forthcoming about how they're struggling and also forthcoming about helping other people. So be one of those people. As soon as you come into medical school, that's the way to be. And don't worry about not understanding things. You're allowed to not understand things.
Yeah, I think this is one thing that I like to touch on within different medical schools is obviously me being from a science background, biomedical science, it's almost the gold standard as somebody that wants to study medicine after they graduate. So I'm just wondering how does the competitiveness vary at Warwick? Like, is there still like an underlying competitiveness between the cohort? Or is it more so that everybody's made it now? All you need to do is hit those passes, and then you're a doctor.
I definitely say the latter, and I think it's different in, potentially other cohorts in other universities, and potentially there are people in my year who are like that, but I haven't noticed. Fundamentally, if you're at medical school, if you get the lowest marks and pass, it's still going to be a doctor, So if you have really high marks and want to use that, then that's fine. But as long as you have an MBBS, MBCHB, something like that, you're going to be a doctor. So I think the more you realize that, and I think people realize that more with graduate entry medicine, where people are, a bit more mature going into it, perhaps. I think that's definitely more of the ethos.
Yeah, I guess personally, within yourself, how did you? I just wonder, how did you find the transition from obviously studying a non-humanities? Like, obviously, you probably have really different like revision techniques that you had to adopt, and revise. Even revising the content must have been like astronomically different. So, how did you find the transition from your previous degree to medicine?
I mean, obviously very different, but actually probably not quite as different as I had expected. So like my note taking style did change. And I've done a lot more of medicine is learning what's on the slides and the links that they explicitly give. Whereas doing humanities, you're often having to find resources, looking for relevant things. But fundamentally, I work in quite a similar way in terms of how I like to make notes. But my revision techniques differ. But I think it's something that everyone takes a bit of time to get used to. And I don't know anyone who does their notes in exactly the same way they did as in the first block. And that's okay. I think it's just a matter of finding what works for you. And I know in our medical school, at least, we have PPD, which is like personal and professional development. Particularly when we first started, they talked to us about, learning styles would change, your sort of how you feel about the course. So we've had to sort of record sort of things about our well-being and how we plan to look after ourselves, how we plan to look at our learning. And I think if you create a culture of being aware that that's going to change your ways of learning, because it is different to most humanities degrees and most sciences degrees. I think that realization, particularly that medicine is not like other degrees at all, is really useful, because it means that regardless of your background, you're going to be making different changes to how you work. And I think, again, that's something I've spoken about with other people in my course. And when you speak to other people about it, you know that it's normal and it's okay, that you haven't found your way yet. Basically, I know that was a bit of a waffle, but that's just how I feel.
Oh yeah, totally. And I guess to add on top of that, the people that I've spoken to who are currently at Warwick are Ollie and Abigail in year 2. They both expressed that even though medicine's graduate entry medicine, there's a degree nothing like it, but you have to adapt very quickly to the course content because there's so much of it. Do you feel like sometimes you're cramming 2 years into one, so I guess you have to be on top of your game all the time to get the course content done, but I guess you're in the same boat as everybody else.
Yeah, I definitely had a fear when towards December, where I realized that if I had a cold or something that made me not work, that I would get really behind. And I feel like that probably is just a factor of the nature of the course, that you're often trying to get your lectures in. We have sort of a tick list of the lectures for each week, and I try and aim to do them before the weekend so that my weekend is for relaxing, and if I do need to do work, that it's sort of revision or collating things rather than trying to learn content for the first time. Though, there are some weeks where that doesn't happen, and that's the thing. It is really busy and you will fall behind. Everyone does. You get sort of consolidation weeks, they're called, which are basically like reading weeks, so you can use those on the holidays, and lots of people catch up on lectures in that time. And that's okay. You're gonna see all this content is coming at you fast. You can recognize this stuff even if you're not going to remember it down to the fine details straight away, because you've got time to go over that. And lots of the topics we look at in first year, we look at to a certain level, and then we'll come back to them in second year, third year with more detail and depth. So you'll go over them then as well. So there's always time to learn stuff.
Yeah, and I guess obviously with it being such an intense course, how do you find managing the time for like extracurriculars and your actual academic studies? I guess obviously you must be really really good at time management to include both of them.
Yeah, I mean, I think things are probably quite different in terms of extracurricular because of COVID, but I still have managed to be involved in quite a few things. And I think particularly because there are so many medical school specific societies, that's really useful. I am a member of some societies that are nothing to do with the medical school, but the medical school does have societies for sports, for academic interests. So I'm a member of a few sort of academic societies, related to specialties I'm interested in. And I think particularly because the medical school ones are made up of all medical students, people are aware of limitations, difficulties, busyness, and I think work around that. So I think from what I've seen, I know a lot of people who've joined societies and gone to virtual currently events. I found that personally, I've always been somebody who really likes extracurriculars, and I do quite a lot, probably do too much, but I definitely still do less than I did with my first degree. So be prepared that if you want to do graduate entry medicine and you still want to do all the same extracurricular stuff, you probably won't.
Yeah, and I guess it's touching on the point of running your life around medicine, not letting medicine like run your life. You need to be on top of that, because in such an intense degree, even in any degree, you can delve as deep as you want, but it's just first hitting those key points and then knowing when to stop. I guess medicine's probably worse for it, because you can learn from the whole body down to the single cell, so you can never know enough. So I totally agree with that. But go on, sorry.
Oh, I was just saying, I totally agree. And like, that's why I sort of make the time on the weekends that I'm not going to do work. And I go for a walk every day. And that is my time without medicine, because otherwise you need other things, or medicine can drive you mad.
Yeah, yeah, totally. So I guess what does a week in the life of a first year look like at Warwick now? Obviously, it's going to be all you've experienced is probably COVID. So how do you think Warwick's adapted to the COVID times?
To be honest, I think Warwick have been really good. They've been very transparent, in my opinion, about when things have had to change and trying to bring things back to normal as soon as possible. Sadly, all of our in-person teaching has gone this term. Last term, we did have, as first years, we had 1 day a week where we would go into the medical school and have clinical skills teaching and anatomy teaching, where you would spend some time doing different anatomy activities. So looking at the plastinates, and doing things like, a very peculiar thing we do at Warwick is like surface anatomy, where essentially you have some people who come in who are like models, who we wrap in cling film and then draw anatomy on them. We work out by sort of feeling them where different anatomical things would be and draw it on top of them, which is always really good fun. Sadly, we don't have that at the moment. I'd say a week now kind of looks like Monday morning you have a sort of a talk first thing at 9 o'clock, where they just give a sort of overview of the week. There's a time for people to ask questions, and they have a patient of the week who comes along who will have a condition relevant to what you're studying. So when we were doing the lungs and the heart, you might have, you know, someone with a heart condition or with asthma or something like that, and we can just ask them anything about their situation. They'll talk about their experiences, which is really useful. And then we'll have like maybe a CBL session in the afternoon on Microsoft Teams online, where we'll go through a case within a group of 8 with a facilitator. Throughout the week, you get sort of asynchronous lectures, which you just do in your own time, which are all online. So when you don't have scheduled things, that's what you're doing. So you might then, on a Tuesday afternoon, you might have some teaching. You might have some group work for something like the personal professional development, or social and population perspectives, something like that. You have some more sort of social or personal group work. Wednesdays, there's nothing scheduled. It's Wellbeing Wednesday. Thursday, you normally have a CBL session again, with your group. So you have 3 CBL sessions a week, 2 with a facilitator, one you do in your own time. So we normally just back it onto the second session. And then Friday would be when you have your clinical skills and anatomy teaching, which we have online now because of COVID. And normally we would have community teaching and bedside teaching too, once per block, so about 5 times a year. But lots of that's virtual now as well.
So it sounds like it's a very jam-packed week. Every week.
It's pretty busy.
Yeah, so I guess obviously from speaking to different people from different med schools, they've all given me different answers, even through different years at the universities, of how they like to approach the teaching. Like some universities like to approach it and they give you the information, all the information that you need to know, and you go away and learn it. And then other medical schools like to just give you like pointers of informations and then tell you to delve as deep as you want into that particular area. How do you feel like Warwick's approached one of those two scenarios?
So I think Warwick's approach is pretty good because I think it kind of changes. So in first year, with you for each block you have a handbook which has a list of your learning outcomes, and each lecture will say, we're going to be covering these learning outcomes, this is what you should know by the end, and give you the content. Though sometimes they might link things for other ways of understanding, but for the most part in first year they're kind of telling you what points you should be learning, what your learning outcomes should be. So that's quite useful. But I know it's something where after first year, where you're mainly sort of going over things and looking at them in much more depth, there is a lot more independence of working out what you need to know, and choosing to look more at things that you're interested in. So I think it's kind of a mixture of those approaches that progresses as you get more sort of independent, closer to being a junior doctor.
Yeah, and I guess credit to Warwick and all the other medical schools that are adopting it. I think they're adopting more of a you get in placement as early as possible rather than the more traditional way of you learn the content and then you're in placement later on during your med degree. So I guess one of my final questions is what's your vision going into the future then? I know it's
in terms of what I want to pursue.
Yeah. So like, personally, where do you feel yourself going at the moment? Like, what's your interests?
Well, it's difficult to say because there are so many things that I'm interested in at the moment. I'm quite interested in. I mean, you might have seen that Ollie has recently been accepted to the Academic Foundation program, and I think doing that is something I'm quite interested in, because I'm quite interested in things like medical education and leadership. So I think that's something I might want to pursue when I'm applying for foundation programs in the future and within my career. I'm also quite interested in sort of medical ethics and law, so I'd like to try and find a way to incorporate that into my career. In terms of specialties, honestly, probably not surgical, but anything else is basically fair game. Not that I'm saying no to anything in particular. I'm interested in things like pediatrics, things like infectious diseases, even a bit of pathology, which people don't normally like, but who knows?
Yeah, I guess it's you're still at the starting line of your career as a doctor, so I guess that's what your F1 and F2 years are for, to actually decide on what you want to go and study at the end of the day. So I guess
honestly, people take some people, even after they do F2, they spend lots of time trying lots of different things. There's so much choice, and I think that's one of the best things about the profession.
Yeah, and I guess to add on that is it's, as you said in the beginning, it's the stability of the profession as well. Everybody's going to need a doctor at some time, if that be you go into neurosurgery or pediatrics. You're still going to be needed no matter what specialty you go into, and I think that allows you to pursue a specialty that you enjoy without without worry of, as you said at the beginning, am I going to be worried to get a job in this profession, because the jobs are needed everywhere throughout the NHS. So
and they all have their own perks and
Yeah.
interesting aspects. Yeah.
Totally agree. So I guess for future medical students watching this video, what would be like the golden piece of advice you'd give them in terms of, like, one, for their application, and two, like securing that shot at becoming a doctor?
Yeah, so I'd say application wise, the best thing you can be doing to prepare is to make sure you tick the boxes for your application, as we mentioned before. I know that's such a mundane and sort of not the most sort of profound and empowering thing, but if you tick the boxes, you'll get an interview, and then your interview is, that's the time when you can then show them you on a personal level. You don't need to stand out when you're just getting your 2-1 and your UCAT score. Take the boxes, and then when you're preparing for the interviews, just reflect well, sort of make yourself comfortable to do it. I'd say is really the main things. Yeah, I think that's honestly the best thing you can do, is sort of the mental preparation. Yeah.
Yeah, and I guess for what would you give, like, as a golden piece of advice for somebody just starting their first few days out, even at Warwick? They've got their place there. It's their first few days at Warwick. What would be your golden piece of advice to those students?
Talk to other people and communicate with them, and share your feelings, share any good tips you have on memorizing things. People are always grateful of that, because to become a doctor, to train in medicine, you're not one individual. There are lots of people around you, and they will make you better. As when you're in a hospital environment, the nurses, the healthcare assistants, the OTs, the physios, the other doctors will all contribute to you doing your job well. It's the same at medical school.
Yeah.
So, like, foster that good environment. I would honestly say that's one of the best things. I've met so many really nice people on my course, because they're nice and they're not trying to beat each other down. You want your peers to be good doctors, fundamentally, for the good of the NHS.
Yeah. That's it. I mean, you're not on a short course anymore. You're going to be spending the next 4 years with that cohort, so you might as well make friends with them and pass that information on if you have any, and hopefully they'll reciprocate that. So I guess finally, where can our viewers find you online, or if they have any questions, are they able to get in contact with you?
Yeah, so probably the place that I'm most responsive is on Instagram, under Julia the Medic. Just all one, not one word, one handle, Julia the Medic. And yeah, send me a DM. I'll definitely reply.
Perfect. Thank you for that, Julia, and I hope you enjoy the rest of your evening.
You too.
Thank you.
Thank
Take
you.
care.
Bye.